Town Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Well, all right. Hi again, everyone. Welcome to our Thursday Community Service Program. Today, Muenster Memorial Hospital Day, and our friend Brian Roland, the CEO, is with us. How are things going, sir?
Things are going very well. I'm excited to be back after missing a month. But I tell you what, everything at the hospital is basically just blowing and going that's the best way I can explain it. We just finished our 2017 fiscal year. A lot of things happened last year in our fiscal year, bringing on the new provider, opening up the specialty clinic. We've updated most of our patient rooms in the hospital. We have turned around and updated the clinic waiting room area. We had an election last year where none of our board members changed, which as a CEO of a hospital, a CEO period, you really like that, especially if things are going in the right direction. We reduced the losses that we had at the hospital financially from the previous year. We had our volumes in our clinic were up, our outpatient volumes were up. So I tell you what, it was a very busy year. And things really, really went well. We're really looking forward to, obviously using the tag, we got to manage today as we prepare for tomorrow. I really feel that we did a good job managing 2017, at least the fiscal year. And then as we go forward into 2018 fiscal year, a lot of projects going on with the community needs assessment that we did last year or last fiscal year. Kicking off some of those things that we're going to be doing. There's an interesting quote by Winston Churchill, and I'm going to use it in the singular, but I mean this as a hospital and the whole organization. History will be kind to me, for I intend to write it. And that's our goal. And what I see right now at the hospital is, we want our history to be kind, and it's all going to depend on how we're writing it right now. And we continue to work on, the delivering the high quality patient care, which obviously has to be a priority in a small rural hospital. When you're under a microscope, under that magnifying glass, supporting the providers, Dr. Crow Rodney's on board. We're getting her up to speed, making sure the nurse practitioners, Melissa and Yvonne, everything is going positive, and then looking towards the future with Eric Hellman that's going to be coming on board in 3 years, and then we're looking at a couple of other options that we're working on right now. Creating an excellent workplace for our employees. There's a lot of pieces to that. It's not all about money. Sometimes you've got to make changes to make things better. And these things I want to hit on more as the months go on because you can go in a lot more detail. You've got to strengthen our role in the community and then ensuring fiscal responsibility. And that's really an interesting one. You could spend 3 hours just on the fiscal responsibility issue. The big challenge right now, I think, with things that we're looking at is you've got the plight of rural health care as a nation. I don't think I go 2 weeks without getting something in my inbox about another hospital closing, shuttering, laying off staff. Even the big companies, Community Health Services, LifePoint, HCA, their profits, if you want to call it, are down. Their revenues are down. And if they're struggling, rural healthcare is even a bigger challenge. And I think for 2018 fiscal year and going forward, that's going to be the thing that we're really, really going to have to look at closely is how do you manage today as you prepare for tomorrow? Because you see, even in the state of Texas, we had 2 hospitals close last month. And one of them was a retread closure, I would call it. It was slated to close last year. Somebody stepped in and thought they could save it, and it didn't work out, and it ended up closing. And you kind of want to sit back and hopefully learn from what happens in these other facilities, and maybe use that as a buffer with some of the decisions that we make. So, it's interesting. Rural healthcare in Texas and rural healthcare in America is kind of like playing a chess game inside a checkers game blindfolded. You think you know what the next move should be, but the legislative people in Texas are making changes still and every day.
Yeah.
CMS is making changes. Medicaid wants to stick their nose in it and get involved. You turn around and then the federal government, not knowing what's going to happen with the Affordable Care Act or repeal and replace or whatever it's called this week. So it's actually a very interesting time in healthcare, but a very, very interesting time in rural healthcare. And the upside for me, I believe, and Muenster, is I'm heavily involved in the Texas Organization of Rural and Community Hospitals, very involved in Texas Hospital Association, and so I get a lot of information. Now you have to sit down and decipher it, understand, think about how it's going to affect me and what we do going forward. And then you actually have to have I want to call it a lenient board who understand that you know what you're talking about and give you that leeway to make the changes and to do things that might seem a little out of the ordinary, but in the long run you hope and plan for the benefit. So it's been a crazy year. 2018, fiscal year 2018 is going to be even more crazier, just because we still don't know what's going to come out of the special session and how certain things could affect, even as a taxing entity, the tax things that they're thinking about putting caps on. Now you hope you never have to raise your taxes to the point where you have to worry about the cap that they're talking about, but you always have to look at those things. What's Medicare going to do? What's Medicaid going to do? Our goal again is always, we want to have the best health care available in Muenster, in our district, in our county, and in North Texas. And you've got to just be thinking about what is that next move.
Yeah, and I know that's important. Putting taxes aside, you can't survive as a hospital or hospital district strictly on the property taxes you guys bring in. No hospital or district can. You've got to increase services. You've got to increase patient load. And there's a lot involved in trying to attract folks to use your services. And I think you've done a great job of the things you've added, Dr. Crow-Rodney and the other things. And I think what you're looking at, too, over the next year, 2 or 3, is going to be very important as well. You mentioned something earlier in your spiel there about you used the word profit, you used the word revenue or revenue stream. They are in the hospital business truly two different things, because there really seldom these days is any profit in healthcare.
Well, and that's it. And you want to understand, even if you're a not-for-profit hospital, it doesn't mean you don't want to make money.
Right.
But the bottom line is, yes, the revenue that we project is basically an irrelevant number at this point, because once everybody does their cutting and Medicare, the revenue is the gross amount of what we charge, which maybe ends up being 30% of what we actually collect. And so, and the profit side of that is the for-profit piece has so many different meanings, because yes, these larger hospital systems have the people that they have to pay. They have to go through the SEC. They and a lot of other factors that play into it. But even a rural hospital, it's not that you want to have. Yes, you want to make money. You've got to be at that break-even point, because obviously you don't want to use the taxes on an ongoing basis to pay for your operations. And ultimately, that's our goal in Muenster, is to be able to have the taxes to utilize new services and not pay our day-to-day operations.
Yeah. It is one complicated jigsaw puzzle. There's no doubt about it, and I commend you for handling it as well as you have. And hopefully, neither of our local hospitals here will fall under that category you were talking about earlier of hospitals that end up having to close. It's a sad state of affairs in that respect. But I think I think the right moves are taking place under your watch over there, and I appreciate everything you're doing there at MMH, Brian.
Well, thank you very much, and I look forward to being back here next month to talk about more great things that are going on.
All right, we'll be here for you. He is Brian Roland, CEO at Muenster Memorial Hospital. And that's going to wrap it up for our community service program today here on Hometown Radio 1580 KGAF.